Hello, and welcome to this year's open enrollment presentation. My name is Elizabeth Miller. I'm the Coordinator of Benefits for Harford County Public Schools. During this presentation, we will review the medical benefits, which include prescription and vision for most plans, the dental benefits available, how flexible spending accounts work, the life insurance program, as well as an overview of our employee assistance program available through KeepRow. Please feel free to stop or replay slides as you feel necessary. Be sure to write down any questions you may come up with throughout the presentation. Those questions can be emailed to benefits@hcps.org. Additionally, this year we will host 2 live question and answer sessions with our benefit vendors. The first will be on Tuesday, May 11th at 4 p.m. and the second will be on Wednesday, May 19th at 4 p.m. Links to access those sessions can be found in the weekly 411 update newsletter. This year, we are excited to announce that all plan designs and plan rates will remain the same. Plan deductibles, coinsurance, and copays are all remaining as is for the upcoming 2021-2022 benefit plan year. As mentioned, rates will remain as is for all employees unless you elect to change plans during open enrollment. Open enrollment begins on Monday, May 10th and will end at 11:59 p.m. on Monday, May 24th. There are 2 different sets of rates, which are determined by whether you are a 12 or 10-month employee. Rates can also be found in the Benefit Reference Guide, which has been posted to the Human Resources section of the HCPS website. Like the rates for medical, the dental rates will remain the same for the upcoming plan year. Again, only those who make an election change will see a change in their deductions. First, we will begin with the medical benefits provided through CareFirst. Our HMO is Maryland-based with providers in Maryland, DC, and Northern Virginia. If you do not reside in these areas, you have the option to enroll in the plan because your work location is in Maryland. However, you must elect a primary care provider or a PCP within the service area. They have more than 40,000 providers, specialists, and hospitals in Maryland, Washington, DC, and Northern Virginia. You may search for providers on the CareFirst website. In an HMO, care is provided and coordinated by your PCP, which you choose. You may choose a doctor who specializes in family practice, general practice, pediatrics, or internal medicine as your PCP. Each member must choose a PCP at the time of their enrollment. Your entire family may select the same doctor, or each member may choose a different doctor based on everyone's age or medical needs. You also have the option to go directly to a specialist of your choice within the CareFirst Blue Choice Network. This plan does not require a referral from your primary care provider for a specialist visit. However, an authorization may be required by the plan for certain services. This HMO plan has a $150 individual and a $300 family deductible for services provided in the plan's network. This plan does not provide coverage for non-emergency services received outside of the plan's network. Once your deductible is satisfied, your coverage will become available to you. Some services, such as preventative visits, do not require you to meet your deductible first. Other services require a copay. Under this plan, members have a $15 copay for primary care visits and a $20 copay for specialty care visits. Should you go to the emergency room and are not admitted for a 24-hour overnight stay, you will be responsible for $75 copay. A visit to an urgent care center will cost you a $35 copay. As a reminder, all copays are applicable after your deductible has been met. Labs, outpatient, and inpatient hospital services are covered at 100% once your deductible has been met. In addition to the HMO, we offer a preferred provider, PPO core option, and a triple option plan. Our PPO core and triple option plans are national networks that will travel with you. Unlike the HMO, you are not required to select a primary care provider and have the freedom to visit any provider you wish, anytime you wish. Coverage is available for services provided in and out of network. As we view the following slides, you will be able to see the differences in the PPO core and triple option plans. First, we'll begin with the triple option. The amount of coverage the plan offers depends on whether you see a Blue Choice provider, a PPO provider, or a non-participating provider. Out-of-network benefits provide a lower level of coverage in exchange for the freedom to seek care from any provider you choose. If you receive services from a provider outside of the PPO network, you may have to pay the provider's actual charge at the time you receive care, file a claim for reimbursement, and satisfy a higher deductible or coinsurance amount. It is also important to note that out-of-network providers may collect their actual charge for service, while the insurance company will only reimburse their allowed benefit for that service. An allowed benefit is a criteria used by CareFirst to determine payments to physicians. The triple option plan has a $50 individual and $100 family in-network deductible and a $250 individual and $500 family out-of-network deductible. You will be responsible for the entire cost of services up to the amount of your deductible. Once your deductible is satisfied, your coverage will become available to you. The triple option plan has a $15 primary care copay and a $20 specialist copay for level 1 services, or a $20 primary care and $25 specialist copay for level 2 services after your deductible has been met. In the triple option plan, you will pay a 20% coinsurance for any out-of-network service that does not have a copay after your deductible has been met. This plan has no in-network coinsurance under level 1 or level 2. By staying in-network, your benefits are covered 100% after your deductible for services such as lab work, outpatient, and inpatient services. Next, we will discuss the PPO core benefits. Our core plan has a $150 individual and a $300 family in-network deductible, and a $350 individual and a $700 family out-of-network deductible. Any amount applied to the PPO core in-network deductible also goes towards the core out-of-network deductible and vice versa. Coinsurance is a cost-sharing requirement that requires you to assume a percentage of the cost of covered services. In the core plan, you will pay 10% for any in-network service that does not have a copay. The insurance plan pays the remaining 90%. Your cost is 30% for any out-of-network service after your deductible is met. This means that your insurance plan pays the remaining 70%. Like the HMO and triple option, some services require you to pay a copay upfront with the balance paid by the insurance plan. The PPO core plan has a $20 primary care and a $25 specialist copay. Should you go to the emergency room and are not admitted for a 24-hour overnight stay, you will be responsible for $100 of the cost in the core plan. These copays and coinsurance are all applicable after your plan's deductible has been met for the benefit plan year. Included in each medical plan option, CareFirst provides HCPS members with a variety of behavioral health benefits. One of the most important aspects in today's health market is the management of behavioral health. Today, 1 in 5 American adults experience some form of mental illness. As a member of CareFirst, you have access to providers and resources. Behavioral health specialists will be able to help you receive one-on-one support from specialty trained and licensed behavioral health coordinators. These coordinators can help you set up appointments, explain what your treatment options mean, and work with your primary care provider and specialist to help you create an action plan for maintaining your health and help with finding local support groups and other resources. If you find yourself in a situation where you or a covered family member may need to utilize any of the services available through CareFirst, you can find the phone number and website on this screen. Additionally, the specialized telephone number can be found on the back of your medical ID card. As always, it is important to note that should you choose to participate in any of these services, all calls are confidential. No data is transmitted back to HCPS. All 3 medical plans include pharmacy benefits in a 3-tier plan. Over the next few slides, we will discuss your pharmacy benefits in greater detail. As you are aware, taking medications prescribed by your treating physician is important to keep you healthy and well. Not taking medications which have been prescribed to you can lead to worsening health conditions and high long-term health care costs. Our current pharmacy benefit utilizes Care First Rx Choice Pharmacy Network. In this network, you can purchase your prescriptions from various pharmacies, a few of which can be seen on the screen. Please keep in mind our mandatory maintenance program, which requires all maintenance medications to be filled through either CVS retail locations or the CVS Caremark mail order provider. However, non-maintenance medications can be filled at any local in-network retailer. Under each of the available plans, Tier 1 covers generic drugs, Tier 2 covers preferred brand name medications, and Tier 3 covers non-preferred brand medications. Your tier cost is determined by the drug you are prescribed. Under each tier, members are responsible for the amount of the prescription up to the plan's copay. Under the Blue Choice HMO plan, members have a $10 copay for generic medications, $20 for a preferred brand, and $40 for non-preferred brand medications. Under the triple option, members have a $15 copay for generic medications, $30 for a preferred brand, and $45 for non-preferred brand medications. Lastly, under the PPO Core benefit option, members have a $15 copay for generic medications, $30 for a preferred brand, and $45 for non-preferred brand medication. The copays I had mentioned are for a 30-day supply. Members also have the option to have maintenance medications filled through mail order. The benefit of this program is that you receive your medications delivered right to your house without having to go to the pharmacy. Additionally, you save money on your copays when having your medications filled through mail order. On the screen, you will see the copays for prescriptions filled through mail order under each plan. Under the HMO plan, your copays are $20 for a 90-day supply of generics, $40 for preferred brand medications, and $80 for non-preferred medications. Under the triple option and PPO Core plans, your copays are $15 for a 90-day supply of generics, $30 for a preferred brand, and $45 for non-preferred brand medications. As you can see, under the mail order program, members can save a significant amount of money on the cost of copays for additional months of prescription fills. Additionally, it is important to note that all plans have mandatory generic program. This means that if you choose a brand medication over its generic equivalent, you will pay the highest copay cost in addition to the difference in cost between the brand and generic medication. If the generic is not available to you, you will only pay the copay for the brand medication. The mandatory maintenance choice remains in effect. You have the option of filling your maintenance prescription medications at a CVS retail pharmacy or utilizing our CVS mail order program. Mail order is for maintenance medications only. Please be aware that if you have a maintenance medication filled at a pharmacy that is not CVS or through mail order program, you will be responsible for the full cost of that medication. Any medication that is not considered to be maintenance can be filled at any in-network retail pharmacy. For more information about which pharmacies are considered in-network and which medications are maintenance, please refer to CareFirst website at www.carefirst.com. Should you opt to use retail or mail order, you will pay 2 times the tier copay for a 90-day supply. As referenced earlier, this slide provides an example of the cost a member may face if they elect to fill a brand name medication when a generic alternative is available. In this example, the member is responsible for a $45 copay under the triple option plan, and the difference in cost between the brand and generic medications is $50 in this example. Therefore, the member has a total cost of $95 to receive their medication. The next slides will discuss the vision benefits available through the Blue Choice HMO and triple option plans. Please note the core PPO plan does not provide vision benefits. Vision benefits are provided through the Davis Vision Network. Covered under the Blue Choice HMO and triple option plan, members receive preventative eye exams annually and have access to over 60,000 vision providers through the Davis Vision Network. Members can receive annual eye exams with in-network providers for a $10 copay. Frames priced up to $70, members have a $40 copay for. Frames priced over $70, the member is responsible for their $40 copay and 90% of the cost over the $70 limit. Members have a $35 copay for single vision lenses and a $55 and $65 copay for bifocal and trifocal lenses, respectively. For a more detailed list of benefits available under the vision benefit, please refer to the Benefit Reference Guide, which can be found on the HCPS website. CareFirst provides members with online access to their benefits through the CareFirst My Account at www.carefirst.com. Members can view their claims and explanation of benefits, find in-network doctors, facilities, and pharmacies. They can also check the status of their benefits, view, order, and print new ID cards, and even get an estimate of out-of-pocket expenses for a variety of services. Understanding your options when you need medical care is key to getting the best treatment with the lowest out-of-pocket cost. Except for emergencies, your first call should be to your primary care provider. As a CareFirst member, you have many resources available. It is important to maintain a relationship with your primary care provider and use them for all preventative care. However, we understand they may not be available 24 hours a day, 7 days a week. First Help is CareFirst's 24-hour nurse line where you can speak to a nurse and receive advice to determine whether you should wait for your primary care or seek urgent care. CareFirst Video Visit allows you to see a doctor using your computer, smartphone, or tablet to treat things like ear infections, sinus infections, and regular colds. The cost of a video visit varies based on your benefits, but will never be more than $49. Convenience care consists of places like CVS Minute Clinics, including in select Target stores, and Walgreens healthcare clinics. They assist with minor concerns like colds and ear infections. Urgent care centers consist of places like Express Care and Patient First to help with more severe illnesses or injuries when you need care on weekends or after hours. They can treat things like broken bones, allergic reactions, asthma symptoms, and even animal bites. The emergency room is appropriate for acute illness and trauma. Call 911 for life-threatening injuries or illnesses. Many of you may already be familiar with CareFirst Video Visit, which is available to all CareFirst participants. This service provides convenient care when you need it. You can speak with a board-certified healthcare provider through either your smartphone, tablet, or computer for urgent care-related services, mental health services, diet and nutritional counseling, and for support with your nursing baby. To schedule a visit, you must first register and set up your account at carefirstvideovisit.com. Another program CareFirst has in place for members is called Take the Call. This program provides members with support programs to help take an active role in their health. You may receive a phone call from a nurse, health coach, or pharmacist on behalf of CareFirst. They will explain the available program options to you during this call. This program is completely confidential and voluntary. Living a healthy life is all about making good choices every day, and CareFirst Blue Cross Blue Shield can help you do just that. Blue 365 is an exciting program that offers exclusive health and wellness deals that will help keep you healthy and happy every day of the year. Blue 365 provides great discounts to top national and local retailers on fitness gear, gym memberships, family activities, healthy eating options, and so much more. Some of the discount services include fitness products, healthy eating cookbooks, fitness centers, and even medical devices like hearing aids, contacts, and life alerts. In addition to their Blue 365 program, CareFirst also provides various other wellness programs accessible by members of the CareFirst medical benefits. Members of the CareFirst medical plan have access to ShareCare. You can access ShareCare through their website or the mobile app. ShareCare provides motivating resources that you can access anytime and anywhere for things such as their Real Age Test, which is a health assessment to help you determine the physical age of your body compared to your calendar age, as well as other resources such as a personalized health timeline, trackers, challenges, and health profile portal. Members also have access to support resources such as health coaching, weight management, tobacco cessation, and financial well-being programs, all of which can be accessed online through your My account at www.carefirst.com. Additionally, participants can receive one-on-one personalized health coaching through the ShareCare app and program for both disease and lifestyle management. There is no cost to the member, and ShareCare provides confidential coaching by trained nurses and healthcare coaches to provide support to members to manage their overall well-being. Also available through the ShareCare program is ScaleBack. ScaleBack is a diabetes prevention and management program. This 12-month program is for those who have been diagnosed as pre-diabetic or at risk for developing prediabetes. ScaleBack provides members access to a personal health coach who is a registered dietitian to assist with managing their health. This is also a service available at no cost to CareFirst members. Interested parties can enroll by calling the telephone number on the screen. Want to quit smoking? Assistance is now available through ShareCare and CareFirst through the Craving to Quit program. Participants will follow a 21-day module program to teach craving avoidance with an additional 7 daily modules for maintenance. Participants also have access to lifestyle coaches through the program and access to an online peer community and addiction experts. Interested parties can enroll by calling the telephone number on the screen. Financial well-being is important. Through ShareCare, members can access online videos, advice, and other online tools to manage and prepare for their financial future with resources available through Dave Ramsey. To begin taking advantage of these great programs, you can visit the website carefirst.com/ShareCare or search ShareCare in the App Store on your mobile device. So now that you know your benefits, don't forget that your primary care provider is always your best resource, but CareFirst offers you additional resources to help get a full picture of your overall health. CareFirst provides you with preventative care at no cost to you and multiple options for where to go when you are sick. They also have an arsenal of resources to help meet your goals and help manage your health easier. Next, we will discuss the dental insurance plans that are offered to HCPS employees through Delta Dental. We offer 2 dental programs. One is the PPO Comprehensive Plan, and the other is the PPO Plus Premier Standard Plan. Our dental plans are national plans that travel with you. Both plans provide you with in-network and out-of-network benefits. Maximize your savings by visiting a Delta Dental PPO dentist. If you choose a non-PPO dentist, you'll receive coverage, but your out-of-pocket expenses may be higher. If your dentist charges more than a set fee for that service, you'll be responsible for the difference, which is called balance billing. If you need assistance in locating a PPO dentist, you can search for providers through Delta's online directory at deltadentalins.com. The PPO Plus Premier Plan provides cost-saving features and is the next best option if you can't find a PPO dentist. The Delta Premier is a larger Delta Dental network consisting of nearly 80% of dentists nationwide. Members have an annual deductible they must meet of $25 per person or $50 per family. Each covered person has $1,500 of benefits to use each plan year. The plan year runs July 1st through June 30th. In-network and out-of-network services are covered at the same percentage in this plan. Reimbursement for services is based on the PPO contracted fees for PPO dentists, Premier contracted fees for Premier dentists, and Premier contracted fees for non-Delta Dental dentists. The Premier plan also provides DMP maximum waiver benefit, which allow you to obtain diagnostic and preventive dental services without these costs applying to your plan year maximum. The Delta Dental PPO program allows you the freedom to visit any licensed dentist. However, there are advantages to visiting a Delta Dental PPO network dentist instead of a Premier or non-Delta Dental dentist. PPO network dentists accept reduced fees for the covered services they provide, so you'll only usually pay the least when you visit a PPO network dentist. Members have an annual deductible they must meet of $25 per person or $50 per family. If you use a non-PPO dentist, the deductible is higher. It will be $50 per person or $150 per family. Each covered person has $1,500 worth of benefits to use each plan year, which runs July 1st through June 30th. This plan also includes the D&P maximum waiver benefit, which allows you to obtain diagnostic and preventative dental services without those costs applying to the plan year maximum. In-network services are covered at a higher percentage on most benefits than out-of-network services and have a lower deductible. You are only charged the patient's share at the time of treatment. Delta Dental pays its portion directly to the dentist, and PPO dentists will complete claim forms and submit them for you at no charge. If you can't locate a PPO dentist and your dentist is a Delta Premier or non-Delta dentist, you still have coverage, but at a lower percentage. You will usually have the highest out-of-pocket cost when you visit a non-Delta dental dentist. You are responsible for the difference between the amount Delta Dental pays and the amount your non-Delta dental dentist bills. Delta Premier dentists may not balance bill above Delta Dental's approved amount, so your out-of-pocket costs may be lower. Non-Delta dental dentists may require you to provide the entire amount of the bill in advance and wait for reimbursement. Delta Premier dentists charge you only the patient's share at the time of treatment. You may have to complete and submit your own claim forms or pay your non-Delta dental dentist a service fee to submit them for you. Delta Premier dentists will complete claim forms and submit them for you at no charge. When you visit the dentist, you don't need an ID card to check in. Just tell your dentist you're covered by Delta Dental and provide your name, date of birth, enrollee ID number or social security number, and the name of the employer through which you receive benefits. Family members covered under your plan will need to provide your details. If you prefer an ID card, you can access an electronic ID card on your phone by logging into deltadentalinc.com or printing out a paper copy. Avoid potential surprises. If you're planning dental work over $300, you may want to request a pre-treatment estimate. You and your dentist will receive a copy of estimates showing how much your plan covers and how much you're responsible for. Just ask your dentist to request a pre-treatment estimate from Delta Dental. Your Delta Dental plan gives you access to great discounts on laser eye surgery from QualSight and hearing aids from Amplifon. To take advantage of this preferred pricing, just give Amplifon or QualSight a call. A dedicated representative will walk you through the program and help you pick a provider, make an appointment, and receive your discount. Vision corrective services and Amplifon's hearing health care services are not insured benefits. Delta Dental makes the Vision Corrective Services Program and Hearing Health Care Services Program available to you to provide access to the preferred pricing for these services. You can create an online account to keep track of your benefits. After registering, log in to check your plan details, print your ID cards, and much more. Save time and paper. When you go paperless, you'll receive email notifications as soon as a new claim statement is available. Looking for additional information about your dental benefits? In addition to utilizing the HCPS Benefits Office to answer your questions, Delta's Customer Service Center is available at the telephone number on the screen 24 hours a day, 7 days a week. You can check your benefits info and more. Just call the customer service number and follow the prompts. For more complicated questions, call during business hours to talk to a customer service representative. Flexible Benefit Administrators, FBA, administers our Flexible Spending Account benefits, which are also referred to as an FSA. This plan permits you to pay for certain health care and/or dependent care expenses with pre-tax dollars. Any contributions you make to the plan are not subject to any federal, Social Security, Medicare, and in most cases, state or local taxes. Elections in this plan do not roll over from year to year. If you are currently enrolled in the benefit and wish to continue the benefit for the 2021-2022 plan year, you must complete an enrollment during the open enrollment period of May 10th through May 24th online at www.hcps.benalogic.com. If you are currently enrolled in the flexible spending benefit for either healthcare or dependent care and wish to continue the benefit, you must complete an active enrollment during this open enrollment period. This is the only benefit that does not default to your current elections from year to year. You can use these funds for tax dependents such as your spouse, child, stepchildren, even if they are not enrolled in your healthcare plan. You too can enroll in the plan even if you are not enrolled in the healthcare plan through HCPS. The HCPS benefit plan year runs July 1 through June 30. You have 120 days or until October 28th to submit any claims that were paid out of pocket to FBA to receive reimbursement from your account. Additionally, this plan has a use it or lose it provision. However, participants do have a 2.5-month grace period to use any remaining funds following the end of the plan year. The healthcare spending account allows you to set up to $2,750 aside annually to pay for your out-of-pocket qualified medical expenses. The healthcare expenses may be for you, your spouse, or your dependents if you claim them as dependents on your tax return through the tax year in which they turn 26. As part of the CARES Act, participants may once again use funds from their FSA account to purchase over-the-counter products without the need of prescription. Certain medications may still require prescriptions, such as prescription medications, orthodontia expenses, contacts, glasses, medical mileage, copays, deductibles, co-insurance, and much more. The Dependent Care Spending Account allows for tax relief for child care expenses for children through age 12. Dependent care helps you pay for the cost of daycare for your dependents so you and your spouse can work. Eligible dependents for this account must be claimed as dependents on your federal tax return. If you're single or if you are married and filing a joint tax return, you may contribute up to $5,000 each contract year. If you are married and filing a separate tax return, you may contribute up to $2,500 per year. As part of the CARES Act, participants may once again use funds from their FSA account to purchase over-the-counter products without the need for prescription. Certain medications may still require prescriptions, such as prescription medications, orthodontia expenses, contacts, glasses, medical mileage, copays, deductibles, co-insurance, and much more. The Dependent Care Spending Account allows for tax relief for child care expenses for children through age 12. Dependent care helps you pay the cost of daycare for your dependents so you and your spouse can work. Eligible dependents for this account must be claimed as dependents on your federal tax return. If you are single or if you are married filing a joint tax return, you may contribute up to $5,000 each contract year. If you are married and filing a separate tax return, you may contribute up to $2,500 per year. Please note you cannot take advantage of both the Dependent Care FSA and the Dependent Care Tax Credit. In most situations, the Dependent Care FSA offers a higher savings. Eligible expenses under the Dependent Care account include daycare, preschool, before and after care, and summer day camp. It also allows for elder daycare and care for disabled dependents. Members will receive one card, which will be a single card even if you are enrolled in both the healthcare and Dependent Care account. First-time members will receive a card when they enroll. Cards are valid for 3 years, so if you have enrolled in the past, your current cards will automatically be reloaded based on your open enrollment election. If you need to request additional cards for your spouse and dependent children over the age of 18, you can do so through their website or mobile app. The mobile application provides members with even more convenience. Through the mobile app device, FBA provides members with an integrated voice bot to help answer questions related to the FSA account and information about benefits. You can receive SMS messages to quickly obtain your account balance by texting BAL to 97487. Through the app, you can use their barcode scanning tool to quickly determine if a product is eligible to use your FSA funds for payment. Through your account, you can access information, documents, and forms, submit requests for reimbursement, view the video and resources libraries, FAQs, and FBA contact information. Questions? In addition to utilizing the HCPS Benefits Office to answer your questions, FBA's Customer Service Center is also available at the telephone number and fax numbers, as well as by email, which are all listed on the screen. A group life and accidental death and dismemberment insurance program is available through MetLife Insurance Company as a financial resource to protect your family. Life insurance is important for many reasons. As you may know, life insurance is designed primarily to replace income lost as a result of an unexpected death, to ensure that your loved ones can maintain a standard of living, and to provide a peace of mind to you and your family, knowing that your family will be protected and financially secure after your passing. It is important to note that your needs for life insurance may change over time. Open enrollment provides you with the opportunity to adjust your life insurance levels based on your needs. For example, if you recently bought a house, you may want to increase your insurance level to provide funds to your spouse in the event of your passing, so that they may be able to pay off the remaining mortgage. Other reasons may include marriage, a new baby, preparing for retirement, or receiving a salary increase. That's why it's so important each year to do an inventory of what's changed in your life and make sure your life insurance policy still provides that coverage your loved ones may need. This slide provides an example of what to consider when determining how much life insurance you may need. In this example, both James and Laura have monthly expenses of $4,500, the cost of college for their children to plan for, as well as the remaining balance of their mortgage, which is $350,000, and any assets and savings they already have in place. In this example, it is recommended that James and Laura have approximately $1.14 million worth of life insurance. This slide provides another example of how Amy, a 39-year-old single mom of 2 children, her financial snapshot looks like this. She has $2,000 in monthly expenses, $150,000 in mortgage debt, and $15,000 in savings. Her goal is to make sure she has $100,000 to put towards her children's college education, paying off the mortgage on her home, as well as have $2,000 a month for 5 years to cover her children's living expenses. Given these variables, Amy may want to consider coverage of at least $335,000, the sum of expenses she wants to cover, and additional expenses to plan for. Taking a step back to review the basic life insurance coverage, basic life and AD&D insurance allows an employee to purchase a benefit equal to 1 times their salary, rounded to the nearest thousand, for a minimum of $8,000 up to a maximum of $300,000. AD&D provides financial protection for you and your family against expenses associated with accidental death or injury. A reduced benefit is payable should you become dismembered because of an accident. Supplemental life insurance allows you to purchase an additional amount of life insurance equal to 1 to 6 times your salary. Combined with basic life and AD&D, an employee may have 2 to 7 times their annual salary, rounded to the nearest thousand. The minimum amount of supplemental life is $16,000 and the maximum is $900,000 when combined with basic life. Supplemental life insurance allows you to purchase an additional amount of life insurance equal to 1 to 6 times your salary. Combined with basic life and AD&D, the employee may have 2 to 7 times their annual salary, rounded to the nearest thousand. The minimum amount of supplemental life is $16,000 and the maximum is $900,000 when combined with basic life insurance. Dependent life allows you to purchase coverage for your spouse and/or dependent children. Spouse coverage is available at $25,000 and dependent child coverage is available at $10,000. Children eligibility is from birth to the end of the month in which they turn 26. You must apply for supplemental coverage to enroll your spouse and children. With your group life benefit, you also have access to many different services to help you and your family better prepare for life today and in the future through the MetLife Advantages program. This includes grief counseling, face-to-face will preparation, and estate resolution services, as well as funeral planning services for yourself and family members. With your group life insurance, you also have access to many different services to help you and your family better prepare for life today and in the future through MetLife Advantages. This includes grief counseling, face-to-face will preparation, and estate resolution services, as well as funeral planning services for yourself and family members. MetLife also provides HCPS employees with annual RetireWise sessions to offer comprehensive retirement and financial education with the option to meet with a local financial professional. Unsure of just how much life insurance you should take, MetLife provides tools online at metlife.com that you can use to help you determine how much life insurance you should elect during open enrollment. If you were previously eligible to enroll and did not do so, you will be required to complete and submit a statement of health to MetLife. From there, they will be in contact with you directly to determine enrollment eligibility. If your coverage is then approved by MetLife, HCPS will be notified for continued enrollment. The statement of health form will be made available to you through Benalogic when you log in to complete your enrollment elections between May 10th and May 24th. Harford County Public Schools is also pleased to offer an Employee Assistance Program, or EAP, for all employees and their family members or significant others that reside in their immediate household. There is no cost to the employee to use the EAP. KeyPro is the provider of these confidential services. Your EAP is a professional, confidential counseling and referral program intended to help employees and family members deal privately and effectively with any type of concern, some of which can be viewed on this slide. You have access to their call center 24 hours a day, 7 days a week. You will speak with a licensed mental health counselor who will assess your needs and refer you for assistance based on his or her assessment of your specific situation. Some components of the EAP program include up to 8 sessions per employee per issue per year, all at no cost to you. Financial services are another component of your EAP program to help assist you and your dependents to assess financial concerns and determine the most appropriate way to manage your financial situation. The EAP makes it convenient to access network attorneys and helps reduce the financial cost to obtain legal assistance. Through this program, you can receive a free 30-minute in-person or telephonic legal consultation with an attorney who has expertise in your matter, with a 25% reduction in fees should you choose to retain that attorney. The EAP can assist in locating childcare or elder care related services, such as the ones listed on your screen. The plan provides a wealth of convenient services and has consultants available who act as personal concierges. Convenient referral services can help you alleviate stress when you don't have time to do the legwork. A sampling of referral services available is shown on your screen. KeyPro has a comprehensive website with resources for employees and families to provide access to information and resources. The website includes more than 5,000 research articles, interactive wellness assessments, monthly webinars, interactive online trainings, legal and financial resources, and a consumer savings center. The EAP is a valuable resource for you and your household members. Your decision to utilize the services from the EAP remain confidential. Remember, your EAP is only a phone call away, 24 hours a day, 7 days a week. In addition to the benefits discussed throughout this presentation, employees of HCPS also have access to retirement savings benefits through the Maryland State Retirement and Pension System, as well as a 403B and 457B savings plans available through Lincoln Financial Group. More information about these benefits can be found in the Benefit Reference Guide on the HCPS website. As a reminder, all enrollments must be completed before 11:59 p.m. on Monday, May 24th. Open enrollment begins Monday, May 10th. Enrollments must be completed online at www.hcps.benalogic.com. Your user ID will be your employee ID number, and your password is a personal password determined and set by you. If you do not log in during the open enrollment period, your current elections, excluding flexible spending, will continue as is. If you want to enroll in any new benefits, you must complete an enrollment by the deadline. Additionally, if you want to enroll in or re-enroll in the flexible spending account for the 2021-2022 plan year, you must complete an enrollment before the end of the day on May 24th. If you are enrolling dependents on your plan for the first time, you must complete and submit a dependent verification form with proper documentation to the benefits office by June 15th, or your dependents will be removed. The appropriate documentation for verification based on your relationship is outlined in your benefits guide. For example, if you're adding your spouse to your health plan, we will need a copy of your marriage certificate and page 1 of your most recent federal tax return. If you're adding your child, we will need a copy of the birth certificate. Dependent verification forms are available for downloading on Benelogic and hcps.org. If you have any questions about any of the information presented, please contact the benefits office by email at benefits@hcps.org. If you do not have access to email, members of the benefits office will be available by phone at 410-588-5275. Thank you all for your time. Stay safe, stay healthy, stay well.